Thank you, organizers, and thank you, chairpersons, for providing me this opportunity. So I would be speaking on the quality of life parameters of the HERO trial. We know that it was actually comparing Relugolix versus Leuprolide. Yeah. So this was actually published in the European Journal of Oncology. So European Urology Journal by Bertrand Tombal et al. And as we know, the background that HERO trial was actually comparing Relugolix to Leuprolide in CSPC setting, where it was majorly metastatic patients, and advanced localized disease was also included, but these were the ones who were not to be cured by local therapies. And prior ADT was allowed if less than 18 months and discontinued more than 3 months. So the dose, as we all know, for Relugolix with a loading dose of 360 and 120 mg on a daily basis. Well, the primary endpoint was attained. That was a sustained castration rate. So nearly 96% sustained castration rate was there with Relugolix as compared to 88% with Leuprolide. Of course, follow-up duration was 48 weeks, and another week of data was collected for a testosterone recovery. The secondary endpoints, which were actually looking at the cumulative probability of how fast Relugolix is actually making the castration levels, how it is being achieved. So on day 4, day 15, so it was all the key secondary endpoints were actually better with the Relugolix over Leuprolide. And the adverse events, well, the key point over there was that the major cardio events were actually lesser with the Relugolix, 2.9% versus 6.2% with Leuprolide. And this eventually led the approval of Relugolix. So basically, if we, so the slide is actually not, if we look at what the quality of life score, how were they actually done, it was in these patients, and it was through the validated HRQOL validated forms. And these endpoints were at these particular timelines, week 5, 13, and 25, 37, and week 49. So the week 49 was once actually the Relugolix was stopped and testosterone recovery was actually looked upon. Treatment-related symptoms and testosterone recovery was actually looked upon. There was a post-hoc analysis by multivariate analysis. Predictors of HRQOL deterioration were determined by this. So basically, the results were that the cognitive, physical, social functioning, as well as global health status and insomnia largely were quite going down in both the arms. The insomnia scores initially increased in the Relugolix group. Probably it was attributed to the rapid fall of testosterone, but eventually it actually settled. And there was no differences, significant differences found in the QLQ PR25 domain scores between Relugolix and Leuprolide. And testosterone recovery showed no significant differences between the QLQC C30 format domain scores, except for insomnia and financial difficulties, which were higher in the Leuprolide group. So if you look at the baseline characteristics, largely they were pretty well matched, except for the post-hoc analysis where testosterone recovery cohort was taken. There was a bit of not so well matched cohort over there. If you look at the global scores, as we see on the various weeks, week 5, 13. So as you can see, the Relugolix, there's not much of a difference between the global scores, except for the insomnia, which is slightly more in the Relugolix, but eventually over a period of time, that is insignificant. So looking at the URTC QLQ PR25 forms, basically looking at the urinary symptoms and prostate-related symptoms. So there, most of the data was actually quite similar, except that the sexual functioning data, which was actually wanted over there, was lacking. Again, these urinary symptoms and over a period of time was not quite wasn't quite different. The post-hoc analysis showed that the baseline domain scores significantly impacted changes in HRQL domains, except for the physical functioning. Patients with high functioning score and low symptom scores at baseline were at high risk of experiencing a decline in respective domain scores at the end of treatment. And patients who already had HRQL decline at baseline were less likely to experience further decline and even showed improvement at the end of treatment. So this is a graph which is actually showing that the symptoms basically over a period of time with Relugolix almost quite equivalent to the Leuprolide. So thank you.